Hi, my name is Catherine Bellevaux. I'm a 24-year resident of Poolesville and the Executive Director of WAMCO Help. In your inauguration speech, you mentioned the recent health study released by the county. That study ranked Poolesville as last, 36 out of 36 in the county in terms of overall health. As people in that lowest rated zip code, we deserve to be at the top of the list when it comes time to place new programs or expand existing ones. There are many factors that contribute to the low rating, but certainly one of the most important is the lack of accessible services here. We have one doctor in town. We have no county senior center or community center. Ironically, we're a food desert. We are a transportation desert with one bus line with a very limited schedule. The closest public social services are at least an hour away by bus. And because of the limited bus schedule, it would require a 6 to 8 hour time commitment for an appointment at social services if one has no car. It's a 25 to 30 minute drive by car. Without bus service beyond a block from our main street, many people in need cannot use Metro Access. And there are others just beyond Poolesville and Dickerson and Bellsville who are in an even worse position. Executive Elrich, we need you to, one, address the nearly complete lack of accessible services and transportation in the West Up County area. Two, be a strong advocate for a multi-use high school facility to bring equity to this area. And three, since we know that planning and building a new facility is a lengthy project, we need to see a plan to immediately address the current health and transportation needs of the Western Up County area. Thank you for listening.
Thank you. So like I said in the last question, I've got a pretty clear idea of where I want to go with the transportation piece of this. You need to be served. The issue of health services, I was in a meeting at between 4:30 and 5 today where we were talking about the 10, it's more than 10 zip codes, but the 10 worst areas in the county for health outcomes, and about a plan which is early, because I've been here a week and they walked in my office and showed me more paper than I could look at and said I don't have enough time to do everything right now, but they did a quick presentation, and one of the things includes Poolesville as one of the top 10 areas in the county that are severely deficit in terms of health access and services. And so, my intention, I asked my staff to bring that forward and talk to the acting HHS director and to talk to my CAO, because this is a priority for me. I think it's important to address these areas. I mean, the statistics, if you ever want to get depressed, just look at the statistics in this county. We do surprisingly badly in things like infant mortality and maternal mortality. Our numbers are among the worst in the state, which is really, something's wrong. And so we're going to focus on these things. The school is difficult. You've got to get the school system to put that project on the list. But we have begun talks about, could we add a facility to the newer part of the building that could be a multi-use facility that might address, could be, health related, it could be, other services related. That was something we could do sooner than later. And so that's one of the projects that I'm going to have us start looking at and scoping out, because I just don't think it's justifiable to leave this county with the absence of services. And the fact that it's low population doesn't mean you should get low treatment.